I'm Valentina. I'll be your student nurse today. How are you?
I'm doing good.
Good. Can you tell me your name and date of birth?
Yeah, it's Jasmine Hinchliffe, January 2nd, 1996.
Okay, perfect. I'm washing my hands and I'm going to close the curtain to provide privacy.
Okay.
And are you allergic to any medicine, food, or latex?
No.
No? And are there any cultural considerations I should be aware of?
No.
No? Okay, perfect. So the reason why I'm here is because I'm doing a head-to-toe assessment on you.
Okay.
Do you need to go to the bathroom at the moment? Because it is going to take about 25 to 30 minutes.
No, I'm okay.
No? Okay, perfect. And then let me see your wristband to make sure your information. Okay, perfect. Okay, and can you tell me what day it is?
It is Wednesday, September 16th.
Okay. And can you tell me who the president is?
It's Trump, Donald Trump.
Okay, perfect. So she is oriented times 4. Okay. Alright, so I'm going to first start by bringing the bed up. Like this is like if you were laying on a bed.
Okay.
So bring the bed up to a working position. I'm going to elevate the head of the bed to a 45-degree angle. And I'm going to start first by palpating the head to make sure there is no lumps, lesions, or lice.
Okay.
And then I'm also going to like look for the size of the skull and the shape, as well as the color, the texture, and distribution.
Okay.
So I'm just going to go through your head just to make sure there's no lesions. Look at your scalp. And she is well groomed. Okay. Now I'm going to look at the ear to make sure there's no redness or discoloration, nor lesions, no drainage, like a normal drainage coming out of it. And perfect, everything seems to be good. I'm gonna also palpate both ears to make sure there's no lumps. Alrighty, perfect. There's no tenderness. The shape and size of the ears are normal bilaterally. Now I am going to inspect the facial structures. So I'm just gonna go right here on the occipital, the mastoid, just to make sure there are no lumps. Everything seems to be good. Can you go ahead and shut your eyes really tightly for me? Okay, can you open them? Can you smile for me? Can you frown? Okay, perfect. So there's no droopiness. Everything seems to be normal. Now can you tilt your head back for me? I'm just gonna look at your nose. The septum, there's no deviation of the septum. The septum is perfectly aligned in the middle of her face. Everything seems normal. Now I'm just gonna check your eyes. Okay, perfect. Okay, perfect. Her eyes are about 4 mm and they are reacting to light and accommodation. The cornea seems normal, and her eyes overall are great. The iris is good. The visual reflexes are normal. Okay. Now I am going to have the patient follow the movement of the pen. So I'm going to have it about 12 inches and just follow the pen just with your eyes. Okay. Perfect. All right. Perfect. Okay. Now I'm going to inspect and palpate the neck. Alrighty, so I'm going to start with the preauricular nodes, then the posterior, which is the mastoid, the occipital, the submandibular, the the jugulogastric, the superficial cervical, the deep cervical, the posterior cervical, and the supraclavicular. clavicular, which is right above the clavicle bones, and I do not feel any swollen limbs. Now I am going to inspect the tongue and the throat using a tongue suppressor, which is imaginary. So go ahead and stick your tongue out for me, and I'm just gonna check. I see no lesions in her tongue. Her throat looks normal. There's no abnormal swelling or abnormal drainage or odor coming out of her throat. Okay, now I'm going to elevate the bed to 30 degrees to see if her jugular veins are distended. So I'm just going to have you look that way slightly, and her jugular vein is normal. It is not distended. Okay, perfect. Now I am going to assess the carotid pulse. I'm going to look for pulse rate, force rate, rhythm, and symmetry. Okay, and they are 2+ and regular. Now I'm going to be assessing her reproductive system. So Jasmine, do you do your monthly breast exam, self-exams?
Yeah.
You do? Okay, perfect. Alrighty. So now I am going to check her chest and back. I'm first going to start by placing my hands on your shoulder, and I just need you to shrunk your shoulders. Okay, the other one. Yeah, there you go. Okay, perfect. So she has good resistance. Now puff up your cheeks. Perfect. So she has good cheek resistance. Equal response strength is good. Now I am going to look at her landmarks such as her trachea, her suprasternal notch, her angle of Lewis, and her coastal angle. Okay, so her trachea is aligned with the center of her body. Everything seems to be normal. Now, for this next part of the assessment, I would ask you to take your gown off because I'm going to osculate, but you don't have to take your shirt off. And then I'm just going to osculate several different areas, and I just need you to take some deep breaths for me. Okay. Okay, perfect. There was no abnormal sounds, no crackles. Everything seemed to be normal. So now I am going to osculate her aortic, pulmonic, the herbs, the tricuspid and the mitral valve for loudness or like mitral regurgitation. Okay, everything seems normal. There's no abnormal heart rhythm, no evidence of mitral regurgitation. Everything seems to be okay. Now I would osculate the apical heart rate using the anatomical landmark, and I would listen for 1 full minute, and then everything would be normal. I am now going to look at her skin, and well, she doesn't have any hair of the chest, but so I'm gonna look at her skin. There seems to be no lesions, no tenderness is present. Her skin color matches her ethnicity. Alrighty. Now I am going to move to the back to assess her respiratory rate, patterns, quality, as well as her skin in the back. So I'm just gonna have you turn towards that way. Perfect. And then her skin looks intact. There's no lesions on her back. Her skin color still matches her ethnicity. So Jasmine, I'm just gonna have you take a deep breath. Perfect. Her lungs rise and they go low equally bilaterally. Now I am going to osculate your lungs from the back, and I'm just gonna have you do a couple exercises. So the first one is I'm going to have you repeat 99 several times.
99, 99, 99.
Okay, perfect. Now I'm gonna have you repeat 99 again while I listen. Go ahead.
99, 99, 99, 99, 99.
Okay, now say 1, 2, 3.
1, 2, 3. 1, 2, 3.
Okay, and now say E.
E.
Keep going.
Oh, E, 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 E.
Okay, perfect. So no abnormal sounds, everything seemed good. Now I am going to check her anterior and posterior chest, thoracic cage for symmetry, shape, and size. So everything seems to be normal. As well in the back. And then now I'm going to have the patient lay down. So if you want to lay like sideways like that. Yeah, that's good. Alright. And I'm going to check her biceps, triceps, her brachialis, reflex. So first I'm going to do by assessing the brachial, radial, and ulnar pulse. Okay, perfect. I'm just going to do a few movements. Okay, and her pulses are 2+ and regular. Now I am going to see for any tenderness in the joints or any heat. Everything seems to be good. Perfect. Okay, now I'm moving on to assessing the arms. So I'm going to look at her arms. There are no lesions. Her skin matches her ethnicity. I'm touching for any warmth. Warmth is present. Her skin is dry. No discoloration is present. And then I'm going to check her skin turgor. So her skin turgor is normal. It does go back immediately. Now, Jasmine, close your eyes, and I'm going to touch one of your fingers, and you just tell me which hand and which finger it is, okay?
Right forefinger.
Okay.
Right pinky.
Perfect. Alrighty. Now, can you squeeze my fingers? Okay, she has equal strength in both arms. Now I am going to, I already checked her lower extremity of the arms. There's no discoloration, so that means that her venous return is good. Alrighty. Now I'm going to inspect and palpate the axillary lymph nodes. So I'm just going to get in here. Okay, and everything seems to be normal. Now I'm going to be moving on to her abdomen. She is pregnant, so I am not going to put a lot of pressure on her abdomen. Alrighty. So I am going to just look up your shirt. Okay, and I'm going to inspect for any masses, lesions, size, pulsation. So everything seems to be normal. I'm going to osculate every quadrant. So I'm going to start from the lower right. Okay, perfect. Alright, perfect. Now I am going to osculate the quadrants as well to make sure there's no abnormal sounds. Okay, everything seems to be normal. And I would, of course, listen for 1 whole minute on each quadrant. Now I am going to palpate the 9 different regions for any tenderness or masses. Okay, everything seems normal. Active bowel movements are present. And then, are you experiencing any pain whenever I palpate any region of your stomach?
No.
No? Okay, perfect. And when was your last bowel movement?
An hour ago.
Okay, and do you remember the color, the smell, the consistency? Was there any blood present?
It was like brown, but not as like firm as usual.
Okay, perfect. And what about urine? Have you been noticing any like foul smell, like a pink color
No.
that could indicate blood in the urine?
No.
No? Okay. Do you have urgency to go to the restroom, like besides your pregnancy?
Yeah, just the pregnancy.
Okay, perfect. I'm going to put this down. So now I am going to inspect your inguinal area, and I'm going to wash my hands. And this one I'm just going to pretend. So I'm washing my hands. And I'm going to put gloves on. So I will now be examining your inguinal area and private area. I'm just going to assess your femoral pulse. I'm going to palpate the bladder for any distension or tenderness. I'm going to start by your femoral artery. And it's 2 plus regular. Now I am going to palpate your bladder. Her bladder is normal, it's not distended, and there's no tenderness present. Now I would check your inguinal area and inspect and palpate your inguinal nodes, both the upper and the lower, and I would find out that they're both normal and there's no swollen lymphs noted. I'll take my gloves off and again wash my hands. And I would verify again that I did not see any lesions or abnormal drainage from any of her part. And then I would ask the patient to give me a sample of their urine so I can look at the color, the clarity, if have any particles in their urine, they could present like an infection. Okay. Now, Jasmine, I'm just gonna have you lay on your side. Okay, perfect. And now I am going to inspect your posterior. So I'm going to inspect the skin, okay, and your sacrum, and there's no edema in the foot or in the ankles. And I would inspect your anus and see that you have no hemorrhoids, no lesions, no ulcers are present in your sacrum area or in your anus. Now you can go back to laying down in the middle for me. Thank you. Alrighty, so now I'm going to inspect the lower extremities. So I am going to first start by looking at the texture, the venous pattern, the size, skin turgor, and temperature of her lower extremities. So I checked. Everything seems normal. His skin turgor is normal and goes back into place rapidly. I would check her nails for clubbing and her how fast her capillary refills are. So, for example, I would check her fingernails, each one, to see how fast, and her capillary refill is normal. And then now I would inspect the heel and the feet and make sure, like, again, that her toenails do not present any clubbing, which they don't. Perfect. Now I'm going to check the Achilles reflex and the quadricep. So I'm going to have let me scoot that way a little. Sorry. Okay, so I would have Jasmine just push against my hands, and there's good reflex. Perfect. Perfect. Alrighty. And then I would just palpate again every single area to check that there's no inflammation or tenderness. Alright. Now I am in the sitting and standing part of the assessment. So I would make sure that the bed is locked, so like if the patient gets up, the bed doesn't like move from under her, and as well as giving her non-skid socks so she doesn't slip. So can you go ahead and sit for me, Jasmine? Okay, so then I would lower the bed to the lowest position. This is really critical in patient care. And then did you get dizzy when you sat back up?
No.
No? Okay, perfect. And then I would check her pulse, make sure it's still normal, which it is. Okay. Now I'm gonna ask Jasmine if you could stand for me. Okay, and did you experience any dizziness?
No.
Okay, and let me check your pulse again. Pulse is still normal. Okay, now can you take 5 steps forward for me? Or like you can take just 3. Okay, perfect. Can you take those steps back for me? Okay, your coordination and skill movement is good. She has good balance, good gait or gout. Her posture is good, and she is able to stand up on her own. I'm just gonna check here your spine. There's no kyphosis present. She has very good posture. Her posture is normal for a pregnant woman. Okay, now I am just gonna make sure your diaphragm expands good, which it does. Alrighty, and now can you sit back down for me? I'm just gonna palpate the joints for any heat or tenderness like I did previously. There's no deformity, no crepitus present, and she is resistant to pressure. And then I would ask, of course, Jasmine to lay back down if she was on like a patient in the hospital. I would ask the patient if they have any concerns. I would put the bed down to the lowest position again, put both of the side rails up. I would open the curtain, give the patient the call light, wash my hands, and ask the patient if they need anything else.